I asked Dr. Oz, how's it doing? Bobby was there. He said, nobody's ever seen anything like this, so it's great.
That was President Donald Trump at the White House yesterday, touting the new government-backed discounted drug website, TrumpRx. The president also announced the addition of more than 600 generic medications to the site in an effort to help Americans struggling with high prescription costs. Let's bring in Dr. Mehmet Oz, who was at yesterday's event. You heard the president name check him there. He's the administrator for the Centers for Medicare and Medicaid Services. Dr. Oz, thank you for joining us this morning. Let's start with this program, including something that I know some observers were really hoping for, that generic drugs would be included. Tell us about that and why you think this could save the American people some money.
Well, it's not just my thoughts. The Council of Economic Advisors have estimated it's going to save the American people between $500 and $700 billion over the next 10 years. So if we use this most favored nation drug pricing platform correctly, it'll be wonderful for everybody. And maybe I take a quick step back and explain why this concept is so important. Not quite, but almost 1 in 3 Americans, when they go to a drugstore, leave empty-handed because they cannot afford the price of the medications they've been prescribed by their doctor. So as the person who's running Medicare and Medicaid, I'm paying for the doctor to examine you, but I've also got to pay for the medications if you're on Medicare or Medicaid. But if you're not, or you're in a commercial insurance plan, a lot of times you can't afford those meds. And so the president realized that part of the cause of that was that we're paying $3 more, 3-to-1 ratio, 3 times more for the exact same products made in the same factories, often here in America, than they pay for overseas. Didn't make any sense at all. So he insisted that we created a most favored nation drug pricing strategy, which means no more global freeloading. Everyone pays the same amount of money, no matter where you are on the planet. And that goal has achieved massive savings with the 17 largest companies that fulfill most of the branded prescription drugs solutions in America. Now, that stated, that's wonderful. We need to get to the other 90% of drugs, and they're in the generic category. And these drugs are available to Americans, but their prices are all over the place. And so think of TrumpRx.gov like a transparency site. We're going to put as many drugs as possible on the platform, using as many partners as possible. We don't make any money on TrumpRx.gov. It's your government's present to you. All we ask is that you check the prices on TrumpRx.gov before you fulfill a prescription anywhere in the country, because a lot of times the better prices will be available on the website. You can get a coupon. You could have it shipped to you. There's lots of solutions. It was built by a wonderful team in National Design Studio. The head of that studio, Joe Gebbia, actually founded Airbnb. Ed Korstein, a great team of technology experts, has crafted this for the American people. And now more than half of all the prescription interactions in America will have options available at TrumpRx.gov, which is why we have more than 10 million people who've already gone to the site.
You're certainly right. Poll after poll suggests for quite some time now, Americans unhappy with the cost of these sort of medications they need. But let's talk a little bit there are some criticisms that have been levied about the program. Some health policy experts, this is according to the Washington Post, have panned the Trump administration's drug price deal, citing that sometimes prices available on the website are actually higher than elsewhere. So talk to us about how would you mean to address that?
Well, I'd love these critics to check the website today, because with the addition of 7 times more medications yesterday and the inclusion of generic drugs for the first time, we believe we're offering the best prices that you can find in America. Now, listen, we're not trying to sell you anything. We're just making it clear what the prices are. A lot of times you'll go to your local drugstore trusting that the prices there are fair. It turns out the drugstore across the street's got the same drug at half the price. So there's lots of opportunities for arbitrage in the pharmaceutical space. We've found many middlemen are taking a little bit of the action every time they charge you something extra. That's extra money out of your pocket. So by making it transparent what the prices are, you can pick what you want. You might want a branded product for whatever reason, or you might prefer generic. Now you've got all the options out there. And yesterday we added Cost Plus, Amazon, GoodRx, these big platforms that have independently been trying to address this problem, which is a challenge because there's a lot of drugs, prescription medications sold in America. No one company can probably get their arms around the entire business. So these large companies, these pharmacy companies, have now come on board and joined TrumpRx.gov, realizing we might be the option. We might be the one solution for all for transparency, so you can get the wisest advantage out there. Now, remember, if you're out there buying a car, there are a lot of ways for you to figure out if you're getting the best price for that car. Same for trying to buy groceries. We've never had a solution like this for pharmaceutical products, which ends up being one of the most painful financial challenges to the American people who are struggling with affordability.
High drug prices, though, just one part of what we've seen as a real surge in healthcare costs for all Americans across the country. There are poll after poll where voters are unhappy with Republicans because the Republicans are in charge right now. They have the White House. They have both houses of Congress. Are there efforts? Is a plan underway to address costs beyond these drugs?
But without question, drugs are a good place to start because that's a visible example. But there's a great health care plan that we're putting in front of Congress, we've been talking about for a bit, which has changes that will improve the affordability of health care in America. And a lot of the challenges that we're facing occur because there's litigation between parties that actually slows down the ability of government to take bold action in order to achieve the goals that we want, which is to make health care more affordable. But let's just to stay on drugs for 1 second, the kinds of things we're doing are going to also affect the actual fundamental challenges to chronic illness in America. This is part of the MAHA movement. And the MAHA movement really is about making it easier to be healthy in America. So think about this. We're going to start offering on July 1st the GLP drugs, the weight loss drugs, the so-called fat shot, as the president calls them, to all patients on Medicare, all beneficiaries over age 65, and there's a bunch younger who are on Medicare. Now, you might think, well, we're giving it for $50. That's really a bargain because these drugs usually cost more than $1,000. We predict within 2 years we will actually save taxpayers money because by making Americans healthier, by reducing their weight and the downstream problems of diabetes and hypertension, you actually reduce the cost of caring for folks because they don't have chronic illnesses. 80% of the cost of the healthcare system now is driven by chronic illness, and we can make a dent in that. The other big issue that you've been following, I'm sure, quite closely is the fraud, waste, and abuse. If we could take the fraud out of Medicare, just that one action, which we think is about $100 billion, that's the fraud in healthcare that the government pays for, Medicare, Medicaid, the Affordable Care Act, et cetera. We can take that fraud out. We would double the life expectancy of the Medicare Trust Fund. Think about that. A lot of young workers out there thinking Medicare won't be there for them, that beautiful retirement parachute that can catch you and make sure you have insurance in your older years. If we could double the life expectancy of the trust fund for Medicare, that would give you a lot more confidence that the program will be there, and that confidence translates into affordability.
So, Dr. Oz, you mentioned chronic illnesses, but there's also a rise of disease, a number of diseases, including measles, in the country right now, in part because of a decline in vaccination rates. You mentioned MAHA. Secretary Kennedy has been a real skeptic of vaccines, including measles. What about you, sir, and your background? Do you think Americans should be vaccinated?
You should get your measles vaccine. This is an illness you don't want to get. There has been an outbreak. Secretary Kennedy said the same thing, said it last year, said it this year. Especially if you're debating about what to do in the vaccine arena, at least get your vaccine for measles.
All right. Administrator for the Centers of Medicare and Medicaid Services, Dr. Mehmet Oz, thank you for joining us this morning.